self-video of strengths and areas for growth for B-Nurse 505. Hi everybody, I'm Morgan. I've been an ER nurse for 10 years now. During that time, I've worked in Mount Vernon at Skagit Valley Hospital. I've been the full-time charge nurse for 6 years, and I've had the opportunity to be on many different committees within the hospital while I've been here. The committees that have really stood out and made a difference in my career path have been hospital throughput, EPIC super users, disaster and emergency preparedness, and of course the Emergency Department Unit Council. In each of these committees, I feel like I've been given an opportunity to really get involved in the policies and procedures of how the hospital works on a level that I never really saw within the emergency department itself. My time with the Disaster and Emergency Preparedness Committee has certainly had the most impact on me. I've personally been involved in many tragedies that our community has faced, from the I-5 bridge collapse, Oso, the Cascade Mall shooting, the Ebola scare, and many other weather-related crises. My skills as a leader and organizers have been pushed to the limits, but I found that I love working in disaster and trauma management. I recognized that I needed more education for myself and to gain credibility to be able to advance my career. After a spur-of-the-moment decision last fall, I found myself re-enrolled in school and on the path for my master's in nursing at the University of Washington. So here I am now, making this video exploring the skills and competencies of the many different modes of an advanced practice nurse. This particular 505 course has broken them up into 5 different categories for us to explore. They're education, leadership, public health, clinical nurse specialists, and nurse researchers. Education was the first module we tackled. Being an educator has never been a goal of mine or an area where I think I excel. As I was reading through the core competencies of nurse educators published by the NLN, I was trying to identify what area it is I don't feel competent in. I think it comes down to competency number 2, facilitate learner development and socialization. The best and most effective teachers I have had tend to be natural storytellers. They are people who can engage students on an emotional level and instill lessons that last a lifetime and are applied in a variety of situations. I don't enjoy speaking in front of groups, and I'm just not a comfortable lecturer. Obviously in nursing, we are all educators. I'm an ER nurse, and the majority of what we do is focused on improving patient behavior so that illness does not lead to another emergency visit. We teach our patients and our coworkers every day. We see a lot of students in my ER, EMTs, nurses, all the way up to medical residents. I enjoy teaching these students techniques for physical skills, such as IV placements, NGs, and other direct patient care activities. I do well with these hands-on skills, and certainly take pride in seeing others master them. There seems to be a common internal reward we get when we're able to transfer our skills onto another person. It's important for leaders to be able to identify those who are good educators. We must foster this ability to teach and promote our coworkers who are naturally inclined to have this set of competencies. I will continue to work on my public speaking skills and ability to identify the best methods of teaching as this Masters of Nurse course continues. The next module was leadership. I chose to focus on the nurse manager role. The AONE CITES assessment of the competencies for being a nurse manager were enlightening. I like how they broke it down into 3 domains: the science, the art, and the leader within. I'm currently very interested in the science of running an effective ED. I've been very involved with our metrics, throughput, and policy and procedure development. I did attempt to take the AONE Nurse Manager Self-Assessment Test, but quickly realized I need help on the business aspects of how to successfully manage a unit. I'm hoping to see more class offerings in the business realm through this Masters of Nursing program. It's definitely an area of growth I need. The art of being a nurse manager covers many competencies that I currently am working on and developing as a charge nurse. Conflict management, corrective actions, and staff satisfaction will always be areas that a manager should strive to improve themselves in and never feel fully satisfied that they have mastered the necessary skills. Lastly is leadership within domain. This is a surprisingly short set of only 3 competencies per the AONE. I found it interesting that they chose to focus primarily on personal growth here. I certainly plan to keep looking for opportunities for growth throughout my career. Next, we studied public and community health competencies. These roles have always been very interesting to me because it really is where nursing can have the biggest impact. As a hospital nurse, I can make a difference for the one patient I'm dealing with at a time. Nurses that work in public or global health industries can help to institute policies that have long-lasting and far-reaching effects on entire populations. The core competencies for public health nursing are very broad and much more political than the ones we've previously looked at. The Public Health Foundation broke them into 8 domains. The competency that scares me the most on the list is the one that I find to be the most important: policy development and program planning skills. A big part of going on for my master's was to gain skills in this area. I would like to be able to analyze a situation, assess the needs, and utilize the best evidence-based information to put together appropriate policies to improve a situation. In my role in the ED, I've seen too many times when knee-jerk reactions put policies in place that not only didn't resolve anything, but actually made the situations worse. My interest in community health stems from my personal involvement with the fire department, EMS, and the hospital's disaster preparedness committee. I see a lot of opportunities that are being missed and an amazing amount of waste in our current systems. I'd really like to be involved in helping to determine the best way to serve the needs of my community as I continue my education. The nurse researcher. This is a rapidly expanding role for advanced practice nurses. The opportunities to be employed are varied from hospitals, research labs, and many different private industries. The duties of a nurse researcher are ultimately to create better health outcomes for all patients. The concept of doing something significant to improve health is very appealing. In bedside care nursing, we have a limited impact on a single person at a time. In moving into a policy-defining role, we have a much broader impact. However, the research level of nursing truly is the most effective way to make major practice discoveries and modifications that can shape healthcare outcomes across populations and generations. My own personal concerns about my fit for this role are highlighted by both of the researchers we studied in this module. Altruistic goals do not pay the bills or keep a person employed. It'd be difficult to be constantly searching for funding, or perhaps even altering my goals to obtain funding. Also, I'm not the best writer. An ability to effectively communicate in a succinct manner at a very advanced level is obviously necessary to be a published researcher. I thoroughly enjoy tracking metrics, staying current with evidence-based practices, and developing methods to improve care on a small scale, but I do not believe I have the necessary skills or desire to be a professional nurse researcher at this time. In Module 7, we studied the role of clinical nurse leaders. These are sometimes called CNSs, clinical educators, or professional and staff development nurses. They have many different duties which they perform in the acute care setting that have a direct impact on the skills and methodology of the professionals they work with. The varying tasks that a CNL has range from educator, facilitator, change agent, consultant, researcher, and of course, a departmental leader. The CNS that I work with performs all these tasks and more. The ED is an ever-evolving department with new technology and practices constantly being rolled out. A good CNL can be the hero of the department by ensuring that everyone reaches the standards expected of them and receives education in a timely fashion. One area that I need to continue to grow in is my ability to effectively communicate in an engaging way to receive buy-in from my audience that leads to long-lasting change and improvement. It's not enough for people to see that the policies we want to enact. They have to understand the why and believe that it will improve their patient outcomes before they will adopt new concepts. As an aspiring manager, I see how the skills and abilities of an effective CNL are crucial to an organization that depends on ongoing professional development. As recommended by our instructor, I reviewed the competencies compiled by the American Association of Colleges of Nursing. On this site, I found a well-defined set of competencies for clinical nurse leaders. This, in addition to the AONE site, have given me focus for my professional needs as a developing nurse leader. I also discovered a set of competencies that highlights a topic I'm more personally interested in and passionate about. One of the biggest benefits of graduate school seems to be the forced opportunity to pursue topics we may not have taken the time to otherwise research. I discovered nursing competencies listed by the International Nursing Coalition for Mass Casualty Education. I had no idea that such an organization even existed. This information is helping me to further develop a plan for what my fieldwork project will hopefully involve. This project has given me the opportunity to really consider my strengths and weaknesses as they relate to the competencies associated with the roles that advanced practice nurses take on. In doing this, I can better identify the areas I need to focus on to get the most out of my time in this master's program. I'm very excited to continue on my leadership path and look for opportunities to improve my skills in business management, policy writing, and public speaking.